If you're applying to medicine or dentistry in the UK, you may well have already come across my channel where in over 350 videos, we give you all my best bits of advice to how to score highly in the Ucat exam and get into either medicine or dentistry. So in this video, what I've done is taken all kind of like my greatest hits from this playlist here and actually condensed them into my top pieces of Ucat advice for you to follow. So in the next bit, it's going to be a highlight of all my best videos to kind of condense everything into one place. So I hope that you enjoy it, and I'll speak to you at the very end where I'll tell you where you can get some more resources. So first, let's start with what the Ucat is. The Ucat consortium on their website say that the University Clinical Aptitude Test is an admissions test used by a consortium of UK universities for their medical and dental degree programs. The Ucat helps universities to select applicants with the most appropriate mental abilities, attitudes, and professional behaviours required for new doctors and dentists to be successful in their clinical careers. It's a set of skills and tasks that they want to see you be able to do under pressure at a given time. One of the most common questions that I get is, when should I start preparing? How long should I prepare for? How much time should I spend each day doing that? So I'd say you need to do it in 3 stages. The first thing is that you need to grasp the key concepts. Then you need to put them into practice, and then you really need to sharpen the axe so that you're really tight when it comes to exam day. Remember that the Ucat is a mental sprint. It's 2 hours of bombardment, fast-paced, high problem solving that you don't want to overdo. But the thing that people fall down on is when they try and do these 4 or 5 hour marathon sessions where, if you think about it, your brain is just getting bombarded so intensely. But of course, after 4 or 5 hour sessions like that, it's understandable that your performance starts to suffer a little bit. That's only going to make you more stressed, get more worried about it, and then that's when people spiral into a series of bad scores and then find the whole thing very stressful. I want to just reiterate the importance of self-care. When we get stressed, one of the very first things that we do is throw self-care out the window. We start eating rubbish, we start sleeping terribly, we don't exercise, and these are all the things that are just going to keep us in a really nice rhythm, because if you exercise, you tire yourself out, so you sleep well. If you sleep well, then you don't get ridiculous hunger spikes, so you don't eat junk, and the whole thing just stays in harmony. But I'm guilty of having done this myself when I started medical school and I was really stressed, was eating crap, drinking loads of caffeine. When you're in that state of mind, you don't have the same awareness, you don't have that mental acuity that you need for being aware for the Ucat. And these are the things that are going to slow you down, make you make stupid mistakes, and just generally perform lower than your best ability. So don't fall into that trap. No matter how stressed you are, exercise will be the fastest way to get you out of stress. So even if it's a 20-minute jog or whatever it is that you do to just quickly work out that anxiety and stress, just make sure that you do it and prioritize at least 20 minutes a day of exercise, good sleep, and eating well. So when we're sitting the Ucat, we're going to have one of 2 goals. We either have a university in mind and we know what score we need to get. The other goal is just that we're going to go for it, go as hard as we can, get as high a score as possible, see where that leaves us, and see what universities are available to us once we've got our score. Remember the statistic that if you get 100% right, but only make it through 70% of the exam, that is a lower score than if you only get 80% right, but make it through 100% of the exam. That is obviously a difference of 10%. So really something to bear in mind when you're getting bogged down with questions and actually just getting to the end and getting through all the questions. Obviously, as long as you're maintaining a certain level of accuracy, is going to be the best surefire way to score well. The next tip is the good old trust your gut. Sometimes there are things going on that our eyes can see but our brains cannot explain. And there's a lot of science that sometimes that gut feeling when you're not sure otherwise what to do is going to be the likeliest to give you the right answer. In the Ucat, you're given a bunch of tasks and you're asked to perform them under pressure against the clock. So this is a lot more like a performance than a knowledge test. And because of that, it's a 2-hour stint. So really you should get yourself used to putting your brain under that strain for the 2 hours. The test of what you should do, not what you would do. My friend Kenji Tomita gave some really good advice with how you calibrate. He said what you want to do is aim for a score and have an idea of where you want to be. And as you're practicing and testing yourself, get an idea of where you are in relation to that. So if you're doing a lot of high intensity and you're actually doing quite well, then maybe you can rest a little bit, avoid burnout, and kind of crank down the preparation time a little bit. However, on the other side, if you're not doing enough and you're not getting the score that you want, you know that it's time to increase the intensity to get you where you need to be. If you try and do a 5-hour practice session, the same way that if you do 5 hours of sprinting, your speed will reduce, and that will mean that you get a lower score in the practice running up to the Ucat. One of the main areas that we're going to focus on is the use of the actual whiteboard and the marker pen that you get. So to give you an idea, this is about the size of the whiteboard that you'll get, so somewhere between A4 and A5, and then it'll be a marker pen with a kind of this sort of level of nib. Let's see if I can get that. And the time to be using these tactics that I'm going to tell you about now is in that time immediately before the exam. Yes, read the instructions, but if you've done a few mocks, you should know what the instructions are saying and know the key things to avoid, like don't hit end exam when you want to hit end review, just at the end of the sections. All the things that you should know by this stage, so you don't really need to read the section guide because you should be familiar with it. So I always think of the SJTs as the what would Jesus do test. So you need to have knowledge of ethics, teamwork and leadership, communication skills, honesty and integrity, working under pressure, confidentiality, and patient safety. But essentially what you want to do is judge the passages by their length, not by themes. I think that that's pointless. It's more about the techniques within those themes that matter. But length is going to dictate how you go about it. And remember I said, if it's long, I would just guess, flag, and skip. If it's medium, I'd do the targeted read. And if it's short, I would just read the entire thing. So really important to be aware of how you triage the questions and how you go about how you tackle them and whether you do tackle them fully. But very quickly, if you have 1 centimeter squared and you want to get to 1 meter squared, it's not just timesing it by 100 the same way that you would do if you were turning 1 centimeter into a meter. Because it's squared, I want you to imagine that it's little boxes. So 1 centimeter squared by 1 centimeter squared box. And if you were to do that for a meter squared, when you think it's 100 by 100, so what you're doing is you're taking one of these little, maybe like say a Lego block of 1 centimeter by 1 centimeter, and you have to put not just 100, but you have to put 100 in this row, 100 in this row, 100 in this row, and you're going down to 100 rows of that. So it's not just timesing it by 100, it's timesing it by 100 by 100, so you times it by 100 squared. So that's why when you get from 1 centimeter squared to 1 meter squared, you don't times by 100, you times by 100 squared. And if you're thinking cubed, then you're doing exactly the same, except for it's not just the rows up and down, it's the rows to the back as well in 3D. So that was a very quick rudimentary way to try and explain that. One technique that a student recently asked me about, which I really do not recommend, is to skip through and just pick the questions to start with that you're happy answering. So the true false can't tell is usually the case. Don't do that because it's such a waste of time going through everything just to get past it. And then that's precious time that you could be attempting it if you were doing it off the bat. So rather attempt all the questions and go through them. Skip, obviously, if there are ones that are difficult or too long for you to go through, and do it that way. But don't do the opposite, which is skip and then selectively answer questions. More like selectively skip questions if you're not comfortable answering them. So the other key thing that I mentioned earlier is if you are going to skip, make sure you at least guess something beforehand. I just listened to an amazing podcast episode on the Tim Ferriss Show by a neurobiologist called Dr. Andrew Huberman. And in it, he talks about a few supplements and things, but he says that people overlook the importance of good hydration and good rest. So the night before and the days running up to it, make sure you're staying well hydrated, you're staying relaxed, you're staying well rested, because that will mean that on the day you will have your wits about you and you'll be in the best focused position to score highly. If you've got to 45 seconds and you haven't answered the question, you're still not sure what's going on, have a quick look down at your whiteboard, see if there's anything. If you can't get it any quicker than that, it's time to just be ruthless, guess, flag, skip, move on. So for argument sections of the decision-making section of the Ucat, I want you to think of the word reefs, like the Great Barrier Reef. And reef stands for relevance. Is the statement directly connected to the subject matter? Evidence. Is there any proof or is it relying on assumptions? Emotional. Is it free of personal or subjective opinions? The more objective it is, the better. And the last two questions I want you to ask are, is it factual and is it sensible? So the night before, just forget about everything, take it easy, do something that you find relaxing, whether that's watching a film, having a bath, and then just make sure that you get a really good night's rest. So I hope that you found that useful. If you want some more help with your Ucat, I recommend you check out this video here. And you may have already seen that we do a one-on-one coaching program where we've helped hundreds of people now get into their first choice medicine or dental school at the first attempt. So if you want to have me help you with your application, you can apply to join our program and find out more details in this video here. Otherwise, thank you for watching, and I really look forward to seeing you in the next video.